Hello everyone, welcome to Doses Pathology Review. In the last video, I gave you an overview of the causes of cell injury, and in this video, I'm going to focus on hypoxia. So hypoxia is oxygen deficiency at the tissue level, and it should be differentiated from anoxia. Anoxia means complete lack of oxygen. And hypoxia is the most common cause of cell injury and cellular death. And in hypoxia, there is decreased synthesis of ATP. So let's take a moment and talk about the synthesis of ATP. ATP is synthesized in the inner mitochondrial membrane by a process called electron transport chain and oxidative phosphorylation. So as the name electron transport chain implies, there is transfer of electrons from electron donors to electron acceptors, and the final electron acceptor in this reaction is oxygen. So if there is lack of oxygen, oxidative phosphorylation is not going to occur, and as a result ATP will not be synthesized. And if the cell is unable to synthesize ATP, then it's not going to be able to maintain its structure and function, and cellular injury and death is going to develop. So now let's discuss the concept of oxygen content. And oxygen content is the amount of oxygen carried in the blood. So normally oxygen diffuses down the concentration gradient from the air into the alveoli and then into the pulmonary capillaries, and then oxygen attaches to heme groups of hemoglobin where it gets transported into the tissues, and then the tissues are going to utilize this oxygen for the generation of ATP. So the partial pressure of oxygen in the inspired air is termed PiO2, and as PiO2 increases, it increases the partial pressure of oxygen in the alveoli, and it is called PAO2. And as the partial pressure of oxygen in the alveoli increases, it increases the partial pressure of oxygen in the arterioles, and this is called Pao2. And as this increases, it increases the oxygen saturation. So oxygen saturation is the percent of oxygen that is bound to hemoglobin. So if 100% of the oxygen binding sites in hemoglobin molecules are filled with oxygen, we say that the oxygen saturation is 100%. And if 60% of the oxygen binding sites in hemoglobin are filled with oxygen, we say that oxygen saturation is 60%. And obviously in hypoxia, there is reduction in the oxygen content, and this is the equation for measuring the oxygen content. You don't have to memorize it. You just have to understand that oxygen content depends on three factors. These factors are the hemoglobin concentration, the oxygen saturation, and the partial pressure of oxygen in the arterioles. And any reduction in one of these factors is going to reduce the oxygen content and result in hypoxia. So hypoxia can be categorized into four categories: hypoxemia or hypoxia, anemic hypoxia, ischemic hypoxia, and histotoxic hypoxia. So in hypoxemia, the partial pressure of oxygen in the arterial blood is reduced. In anemic hypoxia, the arterial partial pressure of oxygen is normal, but the amount of hemoglobin available to carry oxygen is reduced. In ischemic hypoxia, the blood flow to a tissue is so low that adequate oxygen is not delivered to the tissue despite a normal partial pressure of oxygen and despite a normal hemoglobin concentration. And in histotoxic hypoxia, the amount of oxygen delivered to a tissue is adequate, but because of the action of a toxic agent, the tissue cells cannot make use of the oxygen supplied to them. Okay, so in this video, we're going to talk about ischemia and we're going to talk about hypoxemia. So first, ischemia. Ischemia is the most common cause of hypoxia. So we can say that the most common cause of cell injury is hypoxia, and the most common cause of hypoxia is ischemia. And ischemia can occur as a result of either decreased arterial blood flow to a tissue or decreased venous outflow of blood from the tissue. So if the amount of blood reaching the tissue is low, the amount of oxygen reaching this tissue is going to be low as well. And this can either be generalized or it can be localized. An example of generalized ischemia is heart failure. In heart failure, the heart is unable to pump enough blood to perfuse the various tissues in our bodies. And it can be localized as well. For example, in coronary artery atherosclerosis, there is an atherosclerotic plaque, and this plaque reduces the amount of blood reaching the heart, and this can result in heart ischemia. Ischemia can occur as well because of decreased venous outflow of blood from the tissue. So if there is any venous obstruction, the blood is going to accumulate and build up inside the organ, and as a result, it's going to increase the pressure in the organ, and this is going to prevent further blood from entering into the tissue, and this is going to result in ischemia. And an example of ischemia due to venous obstruction is hepatic vein thrombosis, ischemia due to renal vein thrombosis, and ischemia due to superior mesenteric vein thrombosis. Okay, so what are the consequences of ischemia? Ischemia can result in organ atrophy, and atrophy is a reduction in the size of the organ due to a reduction or shrinkage of the size of the constituent cells. Ischemia can result in infarction of the tissue as well, and here the tissue dies because of the loss of the blood supply, and ischemia can result in organ dysfunction. So the outcome depends on three factors. These factors are the anatomy of the blood supply, the rate of occlusion, and the tissue vulnerability to ischemia. So regarding the anatomy of the blood supply, I can say that the presence or absence of an alternative blood supply is the most important factor in determining whether occlusion of an individual vessel causes damage. We have tissues in our body that have dual blood supply, like the lungs and the liver. So the lungs receive blood from the bronchial circulation and from the pulmonary circulation as well. So if there is any obstruction in one of these circulations, the other one is going to compensate. The liver receives blood from both the hepatic artery and the portal vein, so it is relatively resistant to infarction as well. On the other hand, we have tissues in our bodies that have single arterial supply, like the kidney and the spleen. So obstruction of these vessels is going to result in organ infarction. Another factor that can determine the outcome of ischemia is the rate of occlusion, and generally speaking, slowly developing occlusions are less likely to cause infarction because they allow time for the development of collateral blood supplies. And the third factor that can determine the outcome of ischemia is the vulnerability of the tissue to ischemia. Different tissues have different vulnerabilities to ischemia. For example, neurons undergo irreversible damage when they are deprived of their blood supply for only 3 to 4 minutes. Myocardial cells die after only 20 to 30 minutes, and we have cells in our bodies that can remain viable after many hours of ischemia. So these are the factors that can determine the outcome of ischemia: the anatomy of the blood supply, the rate of occlusion, and the tissue vulnerability to ischemia. Okay, now let's start talking about hypoxemia. And hypoxemia is a condition of reduced arterial partial pressure of oxygen. So the normal partial pressure of oxygen is 75 to 100 millimeter mercury, and the normal oxygen saturation is 94% to 100%. And in hypoxemia, the partial pressure of oxygen is less than 60 millimeter mercury, and the oxygen saturation is less than 90%. And the normal partial pressure of oxygen in the arteriole depends on the percent of inspired oxygen, depends on the ventilation of the lung, depends on the perfusion of the lung, and it also depends on the diffusion of oxygen from the alveoli into the pulmonary capillaries. So now let's discuss the causes of hypoxemia, and these causes include high altitudes, hypoventilation, diffusion defect, ventilation defect, perfusion defect, and cyanotic congenital heart disease. And in the remainder of this video, I'm going to discuss all these causes. So first, high altitudes, and in high altitudes, the partial pressure of inspired oxygen is reduced, and as a result, the P capital AO2 and the P small AO2 are going to be reduced as well. Another cause of hypoxemia is hypoventilation, and the sum of partial pressures of oxygen, carbon dioxide, and nitrogen in the alveoli of the lungs must equal 760 mm mercury at the sea level. And if we assume that the concentration of nitrogen is constant, then any increase in the concentration of carbon dioxide is going to reduce the partial pressure of oxygen in the alveoli. And there are many causes of hypoventilation, like paralysis of the diaphragm, and any condition that can cause depression of the respiratory center in the medulla can cause hypoventilation. Another cause of hypoxemia is diffusion defect, and recall that oxygen has to diffuse from the alveolus into the capillary, and there is a membrane called the alveolar capillary membrane. So anything that can increase the thickness or it can prevent the diffusion of oxygen from the alveoli into the pulmonary capillaries can result in hypoxemia. For example, in interstitial fibrosis of the interstitium is going to result in decrease in the diffusion of oxygen, and in pulmonary edema, fluid is going to accumulate between the alveoli and pulmonary capillaries, and this fluid is going to prevent adequate diffusion of oxygen from the alveoli into the pulmonary capillaries, and this is going to result in hypoxemia as well. Another cause of hypoxemia is ventilation defect, and in ventilation defects, alveoli are perfused. However, there is impaired oxygen delivery to the alveoli. For example, this is what happens normally. Oxygen diffuses from the alveoli into the pulmonary capillaries, and as a result, the partial pressure of oxygen in the pulmonary capillaries is going to increase. So in ventilation defect, this alveolus is not ventilated well, so the partial pressure of oxygen in this alveolus is reduced, and as a result, the partial pressure of oxygen in this pulmonary artery is going to be reduced as well. An example of ventilation defect is respiratory distress syndrome. This is a condition in which there is lack of surfactant. So surfactant is a molecule that prevents collapse of the alveoli. So if there is any lack of surfactant, this alveolus is going to collapse, and as a result, it's not going to be well ventilated, and oxygen diffusion down the concentration gradient is not going to occur, and as a result, the partial pressure of oxygen in the arteriole is going to be reduced. Another cause of hypoxemia is perfusion defect, and in perfusion defects, alveoli are ventilated, but there is no perfusion of the alveoli. An example for that is pulmonary embolus. So as I said earlier, this is what happens normally, and this is an obstruction of the pulmonary capillary, for example by a pulmonary embolus. So this is going to prevent blood from passing by the alveolus, and as a result, oxygen diffusion is not going to occur here, and this is called a dead space. So what is dead space? A dead space is a part of the respiratory system that does not support adequate exchange of oxygen. So here there will be no oxygen diffusion, and the partial pressure of oxygen in the pulmonary arteriole is going to be reduced, and this is going to result in hypoxemia. And the last cause of hypoxemia that we're going to discuss in this video is cyanotic congenital heart disease. And generally speaking, in cyanotic congenital heart disease, there is a defect that causes mixing of venous blood that is not well oxygenated with arterial blood that is well oxygenated, and this shunting of venous blood into the arterial blood is going to cause a drop in the partial pressure of oxygen in the arterioles. The last thing that I want to say is that people with hypoxemia can present with cyanosis when the oxygen saturation is less than 80%, and cyanosis is bluish discoloration of the skin and mucous membrane. So this is the end of this video, and in the next video I'm going to talk about anemic hypoxia and histotoxic hypoxia.